interesting people to you. They are part of my networks, and it's always incredible the kind of work that they do, how inspiring it is, and I like to check in with them to see how they are coping during COVID-19. And today with me is an amazing woman, a stalwart in the social and development sector, Pearl Tiwari. She is the president of CSR and Sustainability at Ambuja Cement Limited. Good evening, Pearl. How are you?
Good evening, Elsa. Thank you for these very warm words of introduction. But yes, I'm good. I'm fine. Still locked up, but good.
So, Paul, you've been in this sector for a very long time. So, can you share a little bit with us the impact of COVID on the communities outside of the big cities? Because you do a lot of work with rural women in several states like Gujarat and Maharashtra, and many of them are the largest self help groups in the country. So, why don't you tell us a little bit about what's the reality over there?
So, really, yes, my work is more in the rural communities of India. And so we are really talking about, so we are spread in about 11 states actually. Some of them very poor communities, some of them slightly more progressive communities. So we stretch from Maharashtra and Gujarat to Himachal and Punjab and West Bengal and all of that. Yes, the impact on the communities is at different levels. So apart from the fact that, as we all know, we have a weak public health system in the rural geographies of India, our biggest concerns have always been in these last 4 months that what would happen if we are not able to control the number of cases at that end, because so the weak public health system really was a matter of not just concern to us but to the communities as well. And when the communities are already just about managing the economy, and then you have a whole bunch of migrants who've been out of their rural geographies, actually sending back money home all these years, who actually have had to return. So there have been problems at multi-level, but I must tell you that from whatever I see of the news, and since I'm locked down, I don't really go out to look at what there is, but what one hears about the cities, I really find that the rural communities we work with have been extremely responsibly behaved, and they've really gone out of their way to see how best they can control things at that end. So, I mean, hats off to them really for the way they've risen to this occasion.
Well, one of the things that most people are worried about, and on a different live cast that I host called Inclusive Cities, one of the things that is worrying is if COVID reaches the rural parts of India, we are not sure if they have the healthcare facilities to cater to their needs and maybe the size of the population. Do you think that's a valid concern, or do you think that they are taking precautions enough and that they will be fine, or what needs to be done to make sure that they are fine?
Exactly. So as I said, it's the public health system is weak. But let me tell you our experience in our geography. So again, as I said, I'm limiting my experience to the 11 states in which we work. But in those states, we find that the public, the authorities or the government system in those areas, not just the public health, but all of it from the collector downwards. When this happened, the collector was given full powers by the government to really be the sole, person responsible. And usually the collector was able to get every department of the government involved in this whole thing of COVID management. And I think they did the best of their what was within their ability. So besides probably also giving diktats to local hospitals to be ready to become COVID hospitals, I think they also created a lot of spaces where they created isolation centers. So we saw in our geographies that when we had several migrants returning, the communities, because we had enlightened them to take care within their own villages, were actually stopping these migrants at the entrance, making sure that they were educated, putting them into these isolation areas for some time till they were sure that they were not carrying any virus, and only then allowing them in. And they were being totally supported. So frankly, I think that in our rural geographies, we've seen a very responsive government, and we've seen a very responsive system, which has actually, in my view, controlled it very, very well. And of course, I mean, I must say that my front line workforce, which is my volunteers in the communities, you mentioned our self-help groups. We have farmer producer companies, we have extension volunteers. So they, along with our teams on the front, even though they were doing this remotely, have been able to, enlighten everybody there how important it is for them to be safe. So besides the behaviors of, social distancing, or, hand washing initially, and now of wearing masks, they've also actually risen to the occasion to make sure. So the village health worker is actually made sure that people don't just walk into the village. Who are they? Where are they coming from? Can we isolate them for a few days? And all this closely with the government system. So I really found the responsibility and responsiveness both at the rural level pretty. It was a pleasant surprise for us, actually. I think they really looked up well this time.
That's very reassuring. So thanks for sharing with us, because we don't get such news, and we don't have the full understanding of the reality in different parts of India as to how COVID-19 is being handled. So I'm glad that in the rural areas, at least in the geographies that you are working in, you feel that they are taking the necessary precautions and can cope with it. I wanted you to share a little bit about your work pre-COVID that you were doing in these 11 states, because it's truly inspiring. Empowering, how did you go about empowering these women? And now that they have reached a state of empowerment, they are themselves taking care of themselves.
So this is an interesting question, and thanks for asking that, because this is what makes us very proud. I mean, this is really so we are in these rural geographies. Our principal objective of doing what we are doing is that we wanted to bring prosperity to the people. We wanted to make sure that, and prosperity is not about only better incomes in the family. It's about health. It's about the way women are treated. It's about the way women believe in themselves. It's about the way the youth go about their careers and whatever else. So really, having done a lot of uh, needs assessment in that area, and we've been around doing this work now for 27 years, we discovered that if we wanted to stick to prosperity as the objective, then there are a couple of things, there are a few things which are non-negotiable. You have to work on them. And those are the ones we've chosen to work on. So one is really water conservation, water management. That's something we do in a very, very big way. Some of our flagship programs, especially in very, very water scarce geographies, Rajasthan, Thar Desert, Saurashtra, Himalayas, in those regions. Then we work on livelihoods, and because this is rural India, we work with a huge number of farmers on agricultural livelihoods. So that's to really look at, can we bring better practices to their productivity so that they can do better on their small fragmented farms. And 85% of the farmers we work with are small and marginal farmers. And then we've started in the last 15 years working on skilling. So we're looking at how do we take youth who've dropped out of the education system and skill them for the industry which is looking for skilled manpower. And then of course we work with women and health in a big way. So we have frontline people doing a lot of health. Initially it was maternal and child health, but now we are working a lot on non-communicable and communicable diseases. We are looking at malnutrition. We are looking at all these tracks as well. And women actually cut across all of what I talked about. But so that it doesn't get lost, we do have a separate vertical which we call women empowerment, which is about, and I remember, Elsa, in one of my first years in this company, when I had tried to start this in our first geography, which is in Gujarat, in Saurashtra, I had to personally be in the villages pleading women to come out of their homes at 7 or 6 in the evening just to get together and sit down and talk. The concept of self-help groups did exist, but they were all unhealthy groups which had been formed and nothing had really happened. And none of the women had time. I mean, the whole day they would do housework, and in the evening also they would do housework. So they would always say, I have to take permission from my in-laws or my parents to come to even talk to us. And today, in that geography, I mean, in all our geographies, we have fantastic federations and self help groups. But in this one geography, I mentioned because that was the first one where it was even getting the first group together was such an ordeal. But today we have about 8,000 women, in one federation, and about 400 self help groups which have formed there. Today, this federation is so strong that whether there is a person who, and we've had examples where somebody had a cobra bite in the night, and some gentleman had to be rushed to a private hospital because that's the only hospital which had the anti venom to treat him. But they needed 20,000 rupees down payment at 11 o'clock in the night. And this man's wife called up the president of the federation, who spoke to the doctor and said, I will come in the morning and give you the money, but you treat this guy today. And we've had examples like this where the federation has become like the superpower of the area, if I may. Today they're working on women who've been widowed and who've been stalked in the past, and how do you deal with that? And in a rural Gujarati community, we have several villages, probably 50, 60 villages today, where these women have identified young widows and convinced the family to allow this widow to wear colored clothes, put a bindi on her head, and wear her churis so that she doesn't get noticed as a woman who is a easy target and get stalked. So lots of social reforms that I see coming in, besides all the fantastic work that they do on micro enterprises and all of that. And this time with COVID, the same self-help group, when the migrants and the laborers came back, and we were all running around looking at rations to manage this family. This is in the first lockdown. We had our self-help, our federation, which actually serviced about 36 villages with ration kits which came out of their grain bank. I mean, these are people who have minimum to give away, but at that point they decided that they wanted to stand shoulder to shoulder with us and participate. And this is what I'm so proud about. And this is a story of one location, but we have this across. So we have lots of very powerful women. And I think if you put power in the hands of the women, that's where the change agents really come about. So we are very proud of the women we work with. This is really in a gist about what we do, honestly.
I can see the joy on your face when you talk about this work. So I can truly imagine that from when you started and to really see where what they've accomplished over the period of 27 years, where during a crisis they themselves can, provide for their own communities. I think in such a scenario, it is so satisfying, gratifying, uplifting, whatever you want to call it. So kudos to you and your team for your persevering work over the years in helping women to become self-sufficient.
Thank you.
I also remember one of those stories you told me once where now these women, the head of the federation, she has a proper office with an AC and like she invited you to come in for a cup of tea or something. I think it's such a proud moment for, you to see all that come about. So, you mentioned about the women in the village, uh, trying to change social norms. And they can do that because they are financially independent. So, can you give us some more examples of some of these social norms that have been changed because they feel more confident to take on society around them? So, of course, the widows, having them wear colored clothes and no identification on the outside that this woman is a widow and her life has come to a complete standstill. But maybe something like, dealing with alcoholic husbands or maybe domestic violence. If you can share some more of these examples so that people will know why it's very important to invest in women and build their capacity.
There are hundreds of stories, Elsa, but I'll pick a few. So you mentioned alcoholism. Gujarat is a state where there's prohibition, and of course, wherever there is prohibition, there is also illicit liquor brewing, as we all know. So there was a lot of alcoholism, and there still might be. But yes, I mean, we've had lots of cases of domestic violence where the women have gone into sometimes very extreme behaviors, where we've actually had to tell them that they can't take law in their hands, where they've actually got a bunch of women together and gone and thrashed a guy. Now that's not something that we really encouraged. But today, what we've encouraged them to do is to get together as a group and to go to the police station, file a complaint, and get this, man who's either harassing a woman because of alcoholism or because of general domestic violence. And we've seen a lot of these cases of women who've been doing this have been brought to book. In fact, can you hear me?
We can hear you.
Can you hear? Okay. So we've also had a very, an experience where one of our federation members came to the federation with a story that in her village, a woman, her neighboring village, a woman had been raped and killed and left in the forest. And it was this federation which really took it upon them to manage, getting this whole episode, to the police and made them file a complaint. So they've gone to those extremes as well. But in our everyday work, we see how careers have changed. I mean, in a Gujarati community where girls could only be allowed initially to do tailoring, which is something I was dead against because, it puts a complete stereotype. Today, we have girls, hundreds and maybe thousands of girls in Gujarat who've been trained, and many of our other locations, even Rajasthan, who've been trained as front office assistants, who've been trained as nursing assistants, who've been trained for the electronics industry. In fact, there is one factory in Ahmedabad which didn't have a single woman. And we asked them to take 12 of our women after they were trained. They turned out to be their best employees. And now we have 112 employees in that one factory, all women, all doing assembly work on electronic, stuff. So we have a lot of, those kind of changes that the federation has brought about. And of course, today we have many of them who've won elections and are sarpanches and are leading several committees in the village. So there has been a change over the last, 2 decades, I would say.
For our international audience that accesses this live cast and the recording, I wanted to point out that India has a law where it's a CSR law where companies that are listed have to set aside 2% of their average 3-year profits for corporate social responsibility, and the mandate actually defines the areas and activities that are sponsored. So I wanted to check with you, Pearl, that when this law came about, and of course this law is pretty unique in the world because I've spoken to many people and they are always amazed at this law. Um, Ambuja Cement Foundation has been working in rural India for 27 years. This law is only in the recent past. Has this law made a difference in your policy making or your grant making or the way you fund your projects? Or does it actually provide guidance? The people who are conscious are going to do it any which way, right? You don't need a law or an act. But do you think that such a law should be implemented in all parts of the world? Pearl, you're on mute. I can't hear you. Pearl, are you there?
Can you hear me now?
Yes, I can.
So, as you said, we've been doing this for 27 years. For us, it was never about doing this because of a law. Um, this law has come into being 5 years ago. And we did this because we really believed as a company that, we've taken land from people around us. And our first responsibility is to make sure that we build those people's lives and not really, ruin it for them. And that's why with prosperity, with our aim, we really put down doing this work. So frankly, even though the law mandates 2%, we were doing this 2% well before the law came into being. I mean, today we spend about 4% every year because it's never been about the law. But yes, the way it made a change is that it was really the founder and the founding management who wanted to do and had this vision that this is what needs to be done from a company's, good neighborhood point of view. Um, but because of the law, you've now got to have an independent committee, which is as statutory a committee like any other board level committee, like your audit committee or whatever. So you have a CSR committee with independent directors. So more independent directors who were board directors of the company got involved. And so because they are now the responsible people, they want to take interest in what is it, what are the highlights, what are we doing. And the interesting thing is that board members ask some very difficult questions sometimes, and so it made us also as a foundation look at issues like, yes, why not, why we should look at impacts, we should look at social return on investment. That's a concept that they understand return on investment. So what is this social return on investment? How do we go back and justify that something like water, which is so critical but which we really need to spend on, and so we started doing that. I go back to the board twice a year to kind of present how the money is being utilized, what our plans are for the future. So there's that much more involvement and vision. And we have fantastic independent directors, very involved, who give me so much time and want to ask questions. So in that sense, I think it's been a very, very good thing. And the only other change that we had to honestly make is, there's a Schedule 7 as a part of this law, which says what are the different things on which you can really spend this money. And it's almost everything. But and since we were doing all of this work in our own locations, we were very easily able to then put this. The work we are doing under that Schedule 7. So we just had to kind of decide what we are putting under which aspect of Schedule 7. Otherwise, it really didn't make any difference to the work or the type of stuff, because the law doesn't insist that you only do this or you only do that. It's given you a very long laundry list of stuff to do. And I think we were already well within aligned with what the law is about. And among many other corporate players, I've been a part of many of these working groups where we've looked at the rules of the law, what is an enabling way to make a company do it, what should not be there. So the law also, as it came in, has been changed, and rules have been amended, and clauses have been come in depending on what is good and what is doable. So I personally think it's a great law, and it's a good thing to have. I mean, we do impact our communities, and it's only fair that we build those communities as we build our businesses. So I'm all in favor of it.
Thanks, Pearl. You're also the chair of the
I
Swedish
can't hear
Institute
you.
Alumni
I
Network.
can't hear you, Elsa.
Can you hear me now?
No.
Hello, can you hear me?
Can you speak up?
Can you hear me? Is it better?
No, I can't hear you.
No?
Can you hear me?
I can hear you. I
I can
can
hear
hear
you, but I
you,
can't.
but you can't hear me. That's strange because we can hear you. Great. So I'm going to try once more to ask this question and see if you can hear me. I said
I can't hear you.
you're the chair of the Swedish Institute Alumni Network in Mumbai, and both of us are part of this network. I was wondering if you could explain the power of the network and what, in particular, was the benefit of attending the Swedish Institute Management Program for India, of which you are one of the first members.
I can see you, Elsa. I can see that you're asking me a question, but I'm unable to hear you.
maybe I can create a banner. If you can look at the bottom of
And
the
now you've
screen.
frozen.
Really? Okay, one more thing. I'm going to try logging in from a different device. Let's see if that works better. Can you hear me now? Is it possible to hear me now? Pearl, can you hear me?
Yes, yes, now I can hear you. Yes.
Okay, great. So, my
Can you
question
hear me?
was, yes, I can hear you. So, my question was,
Yeah, now this is clear. Yeah.
as part of the Swedish Institute, you're the chair of the Swedish Institute Alumni Network. And I was wondering if you could share with our audience as to the power of this particular network and why, and what are the benefits that you may have received in attending this particular program.
Can you hear me, Elsa?
Yes, I can.
Okay, so I haven't heard your full question, but I think I understood it. So the Swedish so I'm really the chair of the Swedish alumni network in Mumbai, and we have 6 such chapters in India. And the advantage of this is that most of us who went to do different programs in Sweden, there were people from the environmental angle, there were people from the CSR space, there were people from human rights, and all the others. And the beauty is that this network is really a network of many students and professionals, and they bring an amazing amount of talent and differences and Alumni Association in Mumbai, and to actually get this whole cohort of different people together to be able to discuss on issues which are interesting to all of us, and basically you know which really makes a better world, if I may. I know this sounds very cliched, but really all of us are working in our own little spaces. Somebody from the environmental angle, somebody with people, some with women, some with the different diverse communities and so on. And it's really been a pleasure to have so many different types of angles of thought together, all from the angle of looking at sustainability, CSR. How can we make India a better place? How do we bring some of the best things that we learned in Sweden? Sweden is really very advanced in many things, especially in sustainability, both environmental, gender. How do we how do we bring some of that to the work we do here? So it's been great to really get this network together. We do a lot of programs, some of them jointly. We attend some programs together. You and I are alumni of the same network, and really, I mean, we bring so many varied things to the table. So I really think that it's about diverse and a range of different issues that interest all of us, and that all of us find some interest of the other in. So for me to help set this up was very, very interesting, and I'm very happy that we have this network together and we work closely to bring some great practices of Sweden into India.
Yes, and Sweden is
I
one
don't
of
know if
my
I'm clear.
favorite countries because Sweden is one of my favorite countries, which is, very egalitarian on gender equality and sets a very high standard for all of us to follow, but also sustainability. And many in the network are working on sustainability
Absolutely. Absolutely.
in different ways. My last question is, we are all stuck at home, we are all in lockdown, and I know you travel a lot for work and for leisure. Are you missing it? And how are you coping?
So yeah, I mean, I'm missing meeting people. I'm clearly missing is with working on the front line with my people. So um, I have tried to kind of set up a lot of town halls and Zoom calls and meeting my own team, which is now a very large team. We have over 1,000 people working for our foundation across. So I meet them on a regular basis on Zoom. But I'd really like to meet my farmers, my women from the village, and be right there in the front. So I certainly miss my travel. I do miss, working as a team. I like to work with people. But having said that, I mean, this lockdown hasn't been so depressing for me. I've been extremely functional with, all the technology that we can use from our homes, and I think work is going on beautifully. So I don't regret that. I love the fact that I save a lot of time not commuting in Mumbai, which is a craze. But other than that, I think I do miss, working with people, and I miss my communities. I also miss just going out and meeting people socially, traveling, which is something I love to do. I miss all that. So I'm hoping that this is behind us sooner than later now.
Well, on that note, thank you so much, Pearl, for joining us this Sunday evening and sharing your thoughts with us, and also those wonderful stories of the women and self help groups and others in your community in the states of Gujarat, mainly that you spoke about, but you work in 11 states. So, thank you for sharing those stories, and thank you for sharing all the wonderful thoughts with us. Have a wonderful evening.
Thank you. Thanks so much, Elsa. You too. Thank you, Elsa, for having me. It was enjoyable talking to you as always. Thanks a lot.
Thank you, and good evening to everybody. And join me next Sunday at the same time, 5 p.m. Stay safe and stay healthy. Bye.